This is the hip extension strength test with the knee extended and the knee flexed. So again, I'm not going to actually put pressure through. I probably won't even have my wife lift her leg because that's likely going to transition her weight onto her abdomen. So again, like for pregnant individuals, I'm probably not going to do this test. I'm going to defer it, or maybe test it in a quadruped position, which takes a lot more stability, but you can still get a measurement against gravity that you want to get, kind of like a bird dog situation. So what I'm going to do is talk you through the test. You guys know how to test strength of hip extension with the knee flexed and extended. I know you guys do, but I want to talk about the dysfunctions as well. Okay, so just a reminder, if we keep our knee extended, let's start there. So knees extended, we want to monitor the greater trochanter. So the greater trochanter we want to monitor, and then we'll ask her to extend her hip, which I'm not going to make her do. But as she extends her hip, again, it should have that constant PICR. Rotate, the wheel should rotate nicely along the axis. If it translates anteriorly, we can think of the anterior capsule being lax or loose, so that it's the path of least resistance anteriorly. The hamstrings here can almost serve as like a tight band, basically not allowing it to posteriorly glide, so it's going to want to anteriorly glide. Okay, so for this, we're monitoring the greater trochanter. We're also testing strength, right? So can she lift her leg up? A normal response is the glutes and hamstrings fire at the same time. So they're simultaneously firing. In a lot of individuals, you'll see the glutes basically not do anything, and the hamstrings just take over. And if you want the knee extended, if the hamstrings are dominant, that knee's going to start to flex. Okay, so you want a simultaneous contraction. A dysfunction would be dominant hamstring, glutes really aren't doing anything, or the glutes are firing, which I don't find this happens often, but it could, where the glutes are dominant and the hamstrings aren't doing anything. So let's say you're like, oh, hamstring dominance, can we even test just her glutes? So a way to kind of isolate the glutes is to flex the knee. You okay there? Mm-hmm. Flex the knee, and I'll just have her pretend like she's gonna stamp the ceiling with her foot. And that's gonna, and she did it, but I'm not gonna make her do that, right? But that's gonna isolate the glutes. So now we're kind of taking the hamstrings out because the length tension curve doesn't allow the power of the hamstrings to control as much as if they're down here. Okay, so she can stamp the ground, still looking at the greater trochanter. Is it anteriorly translating or spinning nicely on that axle, which we wanted that nice axle spin, not a translation anteriorly. Okay, this is going to isolate the glutes. All right, in both of these tests, we're going to see how far can she do it, and then we're going to apply pressure. So we'll stabilize at the pelvis. I'll come around this way. So we'll stabilize at the pelvis and kind of feel for it, and then we'll provide our pressure for the glute max above the knee. Even for the hamstrings and glutes together, you can start above the knee and then work your way to the ankle. Why you're monitoring here is most of the time when people extend, their pelvis gives because their hip flexors are shorter stiff. We know our TFL is shorter stiff, right? So there's an anterior rotation and we get a big lumbar lordosis. A lot of people you'll see the lumbar spine extends too much and the hips are real stiff and don't really move well at all. And that's why people come in with back problems. So when the hip extends, we got to make sure we're getting true hip extension. So that's why I'm monitoring here. That's one dysfunction you'll see is the lumbar spine is too flexible. Again, when you bend the knee, it's like the rectus femoris test, right? If that rectus femoris is stiff, not allowing her to bend her knee, probably aren't going to get a great assessment of the glute strength because rectus femoris is going to be here, which then puts the hamstrings at a good position to help out. And that's where people can cheat. So there's a lot of good information you can get from just these two tests. Hip extension with the knee straight and hip extension with the knee flex.